I'm so excited. It is 7 a.m. in the morning, and it is the first day, not of clinical rotations, but the first day I actually get to go in and see patients. And yeah, we don't have to be there until like 12, and I have to leave the house at like 10. It's 7 o'clock right now. So I'm going to get up and work out because I am working on a new video for you guys. New challenge. The push-up challenge, 50 days. That video is going to come out, but get ready with me this morning, guys. Come on. Can't even see me in this light. Too dark. All right, so before I put my clothes on this morning, like I mentioned to you guys, I'm doing a challenge where for 30 days, I'm doing 50 push-ups, 50 sit-ups, and 30 barbell crunches. I'm talking a little bit low because everybody in the house is like still sleeping. I'm one up at 7 o'clock in the morning. But let me put my little waist trainer thing on and let's go. Cause I need to do this. Getting fat. Can I have a fat doctor? What? Wrong way. right, clothes on. Let me put this hair up. Blue one. Brush teeth time.
Tony Fat. Tony Fat Production.
Breakfast. All right, guys, so it is 10 o'clock. I studied a little bit. I might study a little more today, but I'm headed out the door. See you when I get there. All right, so it's 3 o'clock. We just got finished seeing patients for the first day. It was interesting. We're at a long-term care facility, and so we see different kind of patients. Some come in acutely for different vascular problems or psychiatric issues, and then some stay, well, most stay long-term, right? Because this is a long-term care facility. So for dementia or for, I don't know, different endocrine pathologies. And yeah, I'll tell you guys more about it when I get home. Looking like a fool walking, talking to the phone. So yeah, bye guys. All right, so it's later on in the day, and I finished with my first day seeing patients. It was inpatient at a long-term care facility, and sometimes people have their rotations for psychiatry in the hospital. I even met a guy who wants to do residency for psychiatry in prison. So psychiatry is a vast field. It usually deals with people with mood disorders, whether they're depressed or anxious or manic, cognitive issues like I was mentioning before with delirium or dementia, whether it's Alzheimer's, Lewy body, vascular dementia, substance abuse disorders, again, acute withdrawal or intoxication making you psychotic or manic. And this was a very interesting first day of clinical rotations. I do have tomorrow transmagnetic cranioelectrical stimulation of people with depression. So they put these little nose on your head and you get shocked, and that tries to cure your depression. So that's going to be interesting for tomorrow. Today, I got to see about 4 patients, a lot of them dealing with dementia, not really knowing where they were, or they weren't really oriented to time and location. And so I think this is going to be interesting. Psychiatry to me is kind of sad because it's like, am I going to decline when I get older? It was very sad to see different psychiatric problems and ailments of these, especially elderly people. There were some people when they're young. I haven't gotten to see that yet, but I am interested in psychiatry. I won't rule this out of what I want to do as far as matching, I do want to match as an OBGYN. So I'm going to just take this all in. I'm going to start studying. Right now I'm using psychiatry first aid in UWorld to study for my psychiatry rotation. This is going to be 6 weeks. I don't know if I need to update you guys every time I go to this rotation because it's pretty redundant. And we are going to see different cases, but I think this field is kind of pretty redundant with the cases we see. I think they normally just treat them as far as in a long-term care facility, just with like management of their symptoms. I think these patients are elderly, so they're just trying to see if they are having good sleep, if they're eating right, and then like treating them so they won't get agitated or maybe be verbally or physically abusive to staff. So again, thank you guys for watching. Like, comment, and subscribe. Tell me what else you want to see. Ask me about whatever you want to know. I can tell you as much as I can. And bye guys.